Okay, so today we're going to be learning how to do the fertility massage. The fertility massage technique is used to help support reproductive health, the menstrual cycle, and fertility. It increases circulation to the uterus and the cervix, boosts the immune system, decreases stress, helps reposition a tilted uterus, breaks down uterine scar tissue, improves endocrine system communication, and encourages the liver to remove excess hormones while helping the body expel old, stagnant, and leftover blood and tissue. It is particularly beneficial for people with PCOS, endometriosis, blocked fallopian tubes, blood clots during menstruation, fibroids, or any other type of adhesions within the reproductive organs. It's actually really good for poor egg health, women who may not be ovulating or have unexplained infertility, past miscarriages, heavy periods, and so much more. So there's so many benefits to this type of massage when you're trying to conceive. So before you begin this massage, it's important to note that you should not perform this type of massage during the luteal phase of your cycle. So the luteal phase is the last half of your cycle. So in a normal cycle, that may take place between day 15 to day 28 or 30. And this massage is actually really only done from the last day of your menstrual period to the beginning of ovulation, which can lie between day 5 to day 14. So that's the best time to do this type of massage. The other thing to note is when you start massaging the ovaries, to be very careful not to go too deep, especially if you have ovarian cysts. You should not be massaging over those ovarian cysts in case they do burst. Now to begin your massage, lie down with your back on a mat, bed, or hard surface and get comfortable. Place a pillow under your lumbar region, which is the lower curve of your back. Now the first thing you need to do the first time you do this massage is to find your landmarks, which basically means finding where your uterus lies, finding where your fallopian tubes are, and your ovaries. So the first thing we're going to do is find our navel or umbilicus and the top of our pubic bone. So to do this, you are going to place your thumbs together on top of the navel and then bring your index fingers together into a triangle. And the top of your index finger will hit up against a hard ridge, and that is the top of your pubic bone. And the space in between this triangle is where your uterus will lie. So when we come back to the top of our pubic bone, we can run our fingers to either side. And what you will feel is a bony fragment on each edge, and this is the tubercle of the pubic bone. Placing your hand on one of those tubercles, so say we move to the left tubercle here, and then also placing your other hand on the top of your hip bone and drawing a line between these 2 points. This is where the inguinal ligament lies. And if you run and massage your hands along this ligament, it's very ropey, very easy to distinguish and find. Now finding that line again at the tubercle and the top of the hip bone, divide this line in half and divide this line in half again. So again, that's in half and then in half again. And this is where the ovarian fossa is. And within this ovarian fossa, which is kind of like a pocket, is where your ovary lies. So this is where the left ovary would be. And on the right-hand side, if we did the same thing, finding the right pubic tubercle and the right hip bone, dividing in half and in half again, this is approximately where the right ovary lies. And you may not be able to feel your ovaries, which is very normal, but sometimes you can. And another way that you can find the ovaries is basically measuring about 4 inches below the navel and 3 inches to either side. So 3 inches to the left would be where your left ovary is, and 3 inches to the right would be where the right ovary lies. And connecting the ovaries to your uterus is your fallopian tubes, which will lie somewhere in this area here. So to begin the massage, we're going to begin by starting with the femoral massage technique on both legs by blocking the femoral artery, which is the area between your thigh and your lower abdomen. And you're going to block these with your 4 fingers so that blood flow to the leg will stop and there will be increased blood flow to the reproductive organs, bathing the reproductive organs in nice, fresh, nutritious blood. And you're going to do this for 30 to 40 seconds on each side. So to do this, you're going to press down on the area between your thigh and your lower abdomen around your pelvic region with both of your thumbs or with the pad of your fingers. And you'll begin to feel a pulse here. And when you find the pulse, that means you have found the artery. Cover the area with the tips of the fingers and hold down with fairly heavy pressure to seize blood flow. And hold this for about 30 to 40 seconds. After the 40 seconds is over, you release your fingers and you may feel a warm sensation run down your leg to the extremities as the blood returns down the leg and to your foot. Then you're going to repeat this on the opposite side. So again, finding where that pulse is and pushing down for about 30 to 40 seconds. And you're going to repeat this on each side about 3 times. For the next part of this massage, you are going to use castor oil or some other form of massage oil. And the first thing you're going to do is locate your liver, which lies just below the rib cage on the right-hand side. It's a little bit underneath the rib cage, but you may be able to feel a little bit just below the rib cage as well. And what you're going to do to massage the liver is you're going to start at the bottom right quadrant of your abdomen and massage in circular motions in a clockwise direction up towards the liver, across, underneath, trying to hook your fingers underneath that right rib cage, and then across to the midsection. And you're going to keep doing this for about 2 minutes, this part of the massage. Once you're done with the liver massage, now you're going to move towards stretching out the, not the ovaries, but the uterus. So again, find your navel and begin to walk your fingers down towards the top of your pubic bone. Once you find that, you can hook your fingers underneath what feels almost like a muscle here, and you're going to pull up. So what you're doing here is you're displacing the uterus and moving it away from any other organs that it may be adhered to. And you're going to hold this for about 10 seconds. And you're going to repeat this about 12 to 15 times. Once you're done here, you're going to move to the left-hand side and again find that inguinal ligament. Hook your fingers underneath that inguinal ligament and pull towards the midsection. And again, you're pulling your uterus here, removing any adhesions that may be in place. You will also do the same thing on the right-hand side. And again, doing this about 10 to 15 times on each side. Now, if you notice that you're able to displace your uterus more on one side, so for example, more so on the left and not so much on the right, it almost feels like it's stuck a little bit, that could be a sign that you have a tilted uterus to the right or that your uterus is shifting to the right. And that could be very important to note in your fertility journey. So now you're going to begin to massage the uterus. So you can start at the bottom of, the top of your pubic bone, and again go in circular motions clockwise up towards the navel. And after you do this a couple of times, you could move towards the left ovary and massage across the fallopian tubes to the uterus. And you can do this on the right as well. And you're just massaging these 3 parts of the reproductive system for about 2 minutes here in circular motions clockwise direction, and with just a gentle pressure, nothing too hard. And remember, if you have an ovarian cyst, to not put any pressure over top of that ovary. So once you're done this, after about 2 minutes, you're going to move on to the acupressure part of the fertility massage, which basically means we're going to locate specific fertility acupuncture points, and we're going to put pressure on those points, and with a pretty hard pressure as well. So this first point, you're going to locate basically in line with the nipple line, and it's in the 6th intercostal space, which basically means between ribs 6 and 7. And to find that, you're going to notice that find the bottom of your rib cage here. This is your 10th rib, and then you can count upwards. You can find the 9th rib, the 8th rib, and the 7th, and place your fingers in between that 6th intercostal space in line with the nipple, and that's the first point. The second point and the third point are very easy to find as well. You can run your fingers along the bottom of your rib cage, and when they come together at that point, you can place your finger there and draw a line from there to your navel. The first point here is in the middle between these 2 points, and then in the middle of that point and the top. And these are the next 2 points that you can put pressure on. The next fertility point is called kidney 16, and it's located about a finger breadth away from the umbilicus on each side. There's also a series of fertility points that run along the navel down towards the top of the pubic bone. And instead of finding the exact points here, you can just even massage along this entire length here. Two more points to note is basically if you find the top of your pubic bone and you go about half an inch to an inch above that, and then another inch up, and then move laterally to each side until you hit the hip bone. Fall off the hip bone, and there's 2 points there. So again, about half an inch to an inch above the pubic bone, and then laterally until you hit that bone, and then another inch above that and laterally until you hit that bone. And there's 2 points there as well. And what you're going to do on each of these points is basically apply a very firm pressure and then move that finger on that point in a very, very small clockwise direction for about a minute. And you do this on each point. Once you have done the acupressure part, you can then move down towards your feet and do the reflexology part of the massage. So you can do this while sitting down. You can also do this while lying down and just bring your foot up towards you. And just start with a general foot massage, getting the toes, the balls of the foot down towards the heel. And what you want to pay particular attention to is the reproductive points, the pituitary point, and the rest of the endocrine points. So for the female, The female reproductive reflex point for women is actually on the inside part of the foot. So on the inside part here of the heel. And you could just massage that and put pressure in that area. For the male, it's actually on the outside of the foot. And you can spend about a minute here. Now, the pituitary point is basically on the pad of on the bottom of your large toe here, and you could just put some pressure there. So stimulating the pituitary to release a lot of those beautiful sex hormones that we want. And then for the rest of the endocrine points, you can find the thyroid point almost directly below the pituitary point, but more on the inside of the foot. So if anybody has thyroid issues, you can definitely massage that area. And then another important point would be the adrenal glands, which have a lot to do with our stress and releasing our cortisol when we're under stress. And so if you run your finger just below the big bone here, underneath the big toe, you'll fall into a depression, and that's where the adrenal glands are located. And this may be a tender spot for most people, and that would make sense. And so after you've spent about a minute on each point, you can perform that about 3 times on each one of those points. And then what you're going to do is lie back down again and massage your entire abdomen in a clockwise direction. And you're going to begin at the navel in very small circles and then move out slowly until you have massaged the entire abdomen. And you could perform this about 3 times. Again, here with a moderate pressure, not too deep, not too light. And once you've done this about 3 times, the last thing you're going to do is end with another round of femoral massage. So again, finding that femoral artery, occluding the artery by placing pressure for about 30 to 40 seconds, and letting go, and then doing it on the other side. Again, just lastly, bathing those reproductive organs in some nice fresh blood, bringing circulation and nutrients to that area. And that's the fertility massage. And you could do this on a daily basis. You can do this twice a day. You can do this a few times a week. Again, from the last day of your menstrual cycle to the beginning of ovulation. So about day 5 to day 14 for a normal cycle.